This is the Angel Next Door podcast, where we will talk about all things angel investing, what it is, who does it, how do we find them, what does it mean to invest in an early stage company. If you have ever wondered how you can affect the change you want to see in the world, then tune in to learn more. In this episode, I'm talking to Mark Gannott, an acclaimed economist and expert in women's health financing. Mark shares his journey from studying neuroscience and economics to becoming a pioneer in health economics with a deep focus on underfunded women's health issues like endometriosis. He opens up about personal experiences that fueled his passion and discusses the intersection of finance, pharmacoeconomics, and women's health. Mark also dives into innovative methods like network mapping and the urgent need for more consistent capital in women's health ventures. This insightful conversation is packed with unique perspectives on how we can drive more investment into making the world a better place for women's healthcare. Enjoy the show. Hi, Mark. Welcome to the show.
Hi, thanks for having me.
So, Mark, I'm excited to talk to you. You are a wealth of knowledge about all kinds of things related to women's health, financing women's health. You have all these great tips and tricks. So why don't you just start out, though? Tell us a little bit about your background, how you became such an amazing economist, and all about how you learned about investing and getting involved in investing.
Sure. So it started when I was back at Emory studying neuroscience and economics, which are pretty disparate fields, but also are really the crux of a lot of life science, right? And see, I just happen to love them both. Like, to me, it was really fun. I worked in a neuroeconomics lab, like studying microeconomics, so like the science of decision making and like how people tick, which then they pivoted into suicide for ketamine. And I was like, cool. Like, I had no exposure really to either like suicide or ketamine. And then about 3 months before esketamine got approved, my senior year, my uncle killed himself, and really changed me from wanting to go to med school to wanting to make a more of an upstream difference. So I think that's when I really started to think about the financing a lot, because the reason it took our trial, basically my uncle would still have been here if we could have got our trial financed faster. And my PI at Emory went to the CDC and talked to his old friend. It was like, we need money. And his friend was like, absolutely. It could not have been easier for us, and it still wasn't fast enough. And since then, I buried 23 people, about half to suicide. And so that's something that really deeply has affected me and shaped me. So post undergrad, I was just could not go to med school and ended up at an animal immune conglomerate really randomly because it spreads goodwill and cheer. But I was also burnt out. And it was like the farthest thing possible from all this work. And so I started working with, it's one of my best friends. He lives in Sydney. I met him randomly when he had like 400,000 followers. We scaled to like 8 million. We did like over 1 billion views of the bee, but with mostly dogs and cats memes. So everyone's like, oh, everyone likes dogs. That makes sense. It should. And this is great. To this day, we still run it. We do a lot of views and we get really nice messages from people about how it helps their mental health. Or my favorite message about a man who works with a special needs kid. And he says, basically, it's 24-hour shifts. Around hour 14 to 18, he'll get on our page for 20 minutes and he'll love his job again. But I just get burnt out for a little. And you can see I'm smiling. I still think about this message 3.5, 4 years later. It is the nicest message I've ever gotten. I was talking with the founder of the Marshall Cannabis Association, and he's like, you have a background in studying drugs, which I'm like, yeah, I guess I do. And you're an economist, and I need an economist. He's like, I can build financial models, but I can't really do economic analysis. Well, what I didn't realize was I had been trained as like a health economist, and because of my background, it's pretty much impossible for me to not be a pharmacoeconomist because I can't do it. So I brought their first to context, there's only 4 cannabis economists, including me. And the other ones are all like, oh my God, there's a scientist. And so we did a lot of projects like the Marshall Cannabis Association, looking at proper allocation of cannabis licenses to help people of color and other people who are traditionally disadvantaged by the war on drugs, which is what social equity is. And so I still do a lot of that work, which actually paved the way pretty well for women's health. But that's what got my foray and this happened so fast in business school. By September of my first year, we had already had a project done because it basically started almost before I got to school. And so we did the TAM of cannabis. Like, I introduced the other cannabis economists. And that's when I really started to learn economics, because cannabis is weird. It's just weird. There's so many layers to the way that it's not exactly a biofarm. It's not exactly a farming thing. The people in it, you'll have like PhD neuroscientists to people who are just really good farmers. And it's like, how many fields do you have where you have to have that like primary industry knowledge synthesized with the most erudite ivory tower? And so it really, I think, helps. But it's also like a drug. It's a medicine, right? And if you look at the way people use it, they use it as an over-the-counter ameliorant more often than not. And so a lot of this research helped to hone my skills while I'm in business school. And then I ended up working concurrently at a neurogenomics startup looking at like mental health, really harkening back kind of to my work that I had done in undergrad. That actually helped a lot to both be an economist and in business school working at a startup that was raising money, because it was like bringing all those lenses together and forcing me to constantly not only articulate how these fields are interconnected, but also to further interweave them and to think about from a network standpoint, what are we missing? Because a lot of, I would say, economics is really good systems thinking, and women's health, right? Going there is a lot of systems thinking. So I got a really good baseline while I'm getting my MBA. I went and started working with this other company through some consulting work. The first major client was a company called Gyneco, which are a cannabis endometriosis company. Yodam, the CEO, shouts to you, or is like, hey, can you build me a model? But and also because he's an Israeli, he's like, can you please help me meet some Americans and just other endo players? So I'm like, cool, I'll go and meet some people, because I thought I had knew a little bit about endometriosis, not a lot, but I had been at my other firm. We had started looking at it for women's health because, the neurogenomics firm was really interested in some women's health conditions. And if it's not the most expensive women's health condition, and it might be, it's number two, which I'll touch upon a little bit later. But like the long and the short of it is that I started doing that. And within a few months, I was the best connected person in the world in endo, because there's not a lot of money in it. It's criminally underfunded and everyone's fighting for funding. So all the CEOs are spending every day trying to get funding and trying to push the needle and move things forward. I stand on the shoulders of giants, but by and large, there's no data. You say, how much is that company worth? The disease they're treating costs $30,000 a person, and they save $25,000, and they're costing 20% of that. So you're like, all of a sudden, you're like, that's $5,000 a pop per patient. You expect you're going to have 1 million patients in the next 3 years. There's your money. Which, if you're not like a health economist or a pharmacoeconomist, to be able to go through those assumptions can be quite onerous. And to do a deep dive in the literature, right, that requires generally a pretty robust scientific background.
So you as a pharmacoeconomist means that you're looking at the pharmacology, all the types of drugs that go along with helping some of these diseases, especially like endometriosis, which doesn't get a lot of attention. And so you're trying to see from a broader standpoint, like how does this all work together, and how can we get these startups that are working on some of these diseases that don't get as much attention, how can we get them more attention?
Yes, and I think the real distinguish between like health economics outcomes research, HEOR, and pharmaco, at least in my mind, is pharmacos are almost all pure scientists, a lot of pharmacists. So health economics works well when there's a lot of literature about things. But when it's like, we don't really know what this costs, we don't really understand this disease. So actually, a lot of what I have fewer drugs in my portfolio, more diagnostics and med techs, but that's still, it's because it's not just drugs anymore, right? It's really interventions. Interventions just used to be drugs. And when the word was invented, interventions meant drugs. And now intervention means med device, diagnostic, health tech. And yeah, I work, and also the disease burdens. I like help founders explain to investors, hey, this disease is really expensive and that cost your company a lot of money. And they're like, how much money? If you funded this company, it would save you 5 times what you're spending every year.
Wow.
And you make arguments like that, and they're like, huh. And that's really what my job is, to take all this complex data and synthesize it into I like to say, come up with financial reasons for people to do good. Because I generally take projects that make the world a better place, or I try to. And if you're working in life science, like, your projects do make the world a better place, especially in women's health. So if all
Right.
you're doing is saying, here's the value, because let's be real, women get less than, I know this, women get less than 2% of VC money. There's
Right.
obviously a huge market failure. And it's not like we didn't just have a unicorn, Flow Health and women's health last week. There's so much money in this space, and I don't know why investors aren't seeing it. But if you really ask me what I see my job, it's not about pharmacoeconomics, it's about finance. Pharmacoeconomics is a very good lens, but it's about getting more money into research so that the treatments and the diagnostics and the med devices that deserve to exist and that people deserve to have actually do exist. My firm, Rogue, is an insight solutions firm. And he said what I've always believed, which is the way you scale insights is you become an investor, because then you can see things in a lens that other people can't, and you can understand what's going to make someone a winner. What are the key drivers? What things about a founder can you talk to them and be like, oh, and what are the other intangibles that you're like, oh.
Right. 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 Okay, so your company does insights to help these portfolio companies, these startups, early stage companies private companies, basically. Dr. Brittany Barreto, come
Love
on.
Brit.
Yeah, love her. She came on the show before and talked to us a little bit about women's health and all the work that she's doing and her insights reports.
I work with a lot of private companies, either working with their data or I know also other private people. And it's usually, if you're working on something like endometriosis, like every company has very willingly been like, if you think this data will help other people, please use it.
So how do we work to get more funding to some of these companies that really need it for women's health?
That's a great question. I think one of the things is we need like good financial exits in women's health, and not that we're not getting them, but there's such a streaming problem because really upstream, we're not getting this. In fact, take a step further. I wouldn't be surprised Britt mentioned this. Upstream trial exclusion. Women aren't in clinical trials. So you don't have mirroring data. You don't have the early stage data. You don't have Reese's data or any other animal that you might use and say, we could de-risk this. Let's be real. Investors are trying to de-risk. And if you're a like deep tech investor, which is what a lot of with women's health is going to be, the de-risking process is more difficult. And so one thing I think that would be beneficial is I shouldn't be the only pharmacoeconomist in endometriosis. We should have more people in these different specialties. So there's more access, which means I think we need more life science, like traditional life science people to come in and flood the industry. Because if you look at a lot of the top people in women's health, they have deep experience usually in other life science. And they have contacts in other life science who will co-invest with them. Because I think there's 9 VCs in women's health. That's not enough. If you look at the AUM, there just isn't enough dry powder to fund the things that need to be funded. So you need syndication. And how do you get those syndicates? Well, one way to do it is if you have a consultant from who used to work with a venture capitalist or something. But another problem is there are not women's health consultants, which means they're not in 4 to 5 years. There are very few consultants. So there are going to be very few venture capitalists who have done the work because that pipeline is also an issue. Talking about what networks are going to help to understand what makes a female founder successfully raised. Because I also think there's a disconnect and some women are like, I need to raise money. And even the ones who have a lot of experience, the bar for women's health is so much higher. The best investor I know, who's a dude, he is 34, he has 8 unicorns. It took him 2 years to raise 2 million. And he has one of the best technologies I've ever seen. The dude is running a fund for David Berry, who's one of the top biotech investors. He is running the fund. And they're like, but what do you know about the finance? And he's, what are you talking about? And this is a guy. And it pays to be a man in women's health. They raise more money. And it's still hard. Why? And so that's what I think needs to happen is we need to understand what really we know, but I want fresh insights onto every little thing. I want to know women that raised successfully, what do their networks look like? Women that didn't raise successfully, what were the real complaints? Not, oh, it's too early. But okay, we didn't feel like it was de-riskable for this. I think we need more HEOR. There's just not enough health economics if you look at it. And because value-based care is coming to dominate the landscape for everything. Remember, there's 21,000 pharmacoeconomists and 50,000 HEOR people, which includes the pharmacoeconomist. There's 80 million working adults in the US. It's not enough. So you need more of that. And then you need more, not just exits, but I think we need more really deep finance people to be looking at women's health as a space and just see dollar signs. Because I think there should be, because obviously people don't care about women dying or women being in pain or women suffering. None of these things seem to matter. Okay. There is so much money. Do you care about that? You're a VC. Isn't that your job to make money? And I think that's what's going to take is the continual, not just successful business exits, but the aggressive exits, de-risking, and not just education that the field exists, but rather education of what successful founders in the field look like, so that when the best so it's not just, oh, it's not a women's health person, but then that they're actually treated like a founder individually, as opposed to you come from women's health, so you have a lower valuation, or your first investor was a woman, so we're lowering your valuation, both of which are true things, which is terrible. If anything, it should raise the value. Yeah, when a woman leaves the round, especially in women's health, they think it's a woman's thing, so the valuation goes down.
We need more exit data. We need more people to have the financial and economic modeling to show that these companies have the TAM to make money.
And I think digital health, which is seen as femtech, I would argue that women's health is more like the deep tech and femtech is more like apps and whatnot. But digital health has had cratered exits. So people see femtech or women's health, they think digital health, which in general is not doing well. And they're like, oh, we should stay away. So I also think we need to support the deep tech ones, like shouts to Harrow Biotech. I do a lot of work with them. Their endometriosis non-invasive diagnostic, their TAM is ridiculous. Or companies like Dama Health, who I've done work with, love them. Their birth control, clinical decision support. There's a lot of these opportunities for these deep science companies that I think are just going to make ridiculous amounts of money. And even if it's not that company, it's something doing what they're doing because they're attacking issues that are not only huge, but they're not that hard to disrupt because it's like, why hasn't it been done? There's no financing. If you say women raise 2% of VC money, you can also look at that as it's 50 times easier, 50 for men to raise capital. Plus,
Wow.
women return like 2x what men do. So I just don't understand why people aren't investing more in them. I think if you had a fiduciary duty, you should be like aggressively focusing on funding women because they just return more. I think you can put in your fund strategy. We make women jump through hoops. No, we should do that to men. Economically, we should make men have a much higher bar. So I want to kill endometriosis. I want to fund different companies to eventually gene edit it out of existence. First step is diagnosing it. Then you just make small bets, 10, 15 years, small bet here, small bet there. Do you want to run a company that's going to go to war with this? We'll give you money. All you need to do is you to put there. But you can't do any of these things if you can't get consistent capital.
Yes, consistent capital. That's a good way to put it. Because they get started and they get so far and then they just can't.
It's horrible. Companies that have basically made it through clinicals, they had no more money. Spent every
Wow.
dime the investors go, we just think that we should be getting returns already. Like, we just made it through clinicals, dude. We're commercialization. The investor like, let's just sell the company. And so
Wow.
risk tolerance is part of it. Things like this insight, like there's a thing that's published every 10 years. I have an Excel model for your likelihood of exiting if you're a life science company. That's the kind of thing that helps de-risk women's health because the investors are like, this is risky. You're like, but do you know how risky it really is? They usually don't. A lot of your really good investors are like very finance heavy, but you need to be what I call finance or science finance to do any of this. And that's just a lot rarer. So unless you have somebody who can de-risk it, who understands both of them, it's easier to be like, why invest in what I know? I don't understand women's health. I'm not investing in that.
Finance. I like that.
I got sick of saying life science finance.
That makes a lot of
Finance.
sense. Finance. Yeah.
Yeah.
That's awesome. Tell me a little bit about how you're trying to show the networks of different people and how you're trying to get that all together.
Yeah, I would show you, but this is a recording. But so this is really, my buddy introduced me to this really cool program for network mapping called Kumu that I started playing with. It's intuitive, but
How do you
like
spell
it's
it?
really KUMU. So you can take people's LinkedIns and then you can upload those LinkedIns into Kumu and it will show you who's connected to whom. But then you can also take a step further and see, okay, who has the most connections? And more importantly, who is not connected to whom. So Marcia, if I'm sitting with you and I'm like, oh, you should know my friend Sam. How do I know if you know my friend Sam? I don't. But if I had this network analysis, I can be like, wow, Sam and Marcia both do like women's financing. That's kind of niche. And so you do things like tag them, right? So for instance, it started with reproduction. I only know about 20, maybe ish, like very significant reproduction players, 10 to 20, right? Who are like, you people have to know each other. Most of them know each other, I think. But I don't know. And see, if I had this network mapping, I could just look at it and go, oh, shoot, you don't know her. Let me make an introduction. And so what we want to do is actually map a lot of these, not just key decision makers and key opinion leaders, but like nexuses and nodes of networks. And especially people who are working to drive things forward. If you have a coalition, say you have 4 or 5 people working on the same thing, you can map everyone's networks to make sure from the jump that they all know all the people they should. And because you can do it, you can slice it really easily over different things. Like you can do schools and you can say, do MBA grad student, MBAs, and you can switch to undergrad. It will automatically show you, oh, reconstitute from these are the MBAs who know each other to these are the undergrads. So the ability to really quickly parse different kinds of networks from you're an investor or looks like, say, these investors have dry powder, which are another things you can visually indicate. You can take these insights and rapidly distill this. And so we want to use this network analysis to understand like where people who are working, especially in niche areas, or people who have similar complementary skills or who need things when they should know each other, they just don't. To make sure that you have better coalition building, because ultimately, I think one of the things that will help women's health is good coalitions where people are in these communities and ecosystems and they just want to help each other because a rising tide lifts all boats. And it's not what can I get out of it? It's what can the field, does the field going to benefit? And if you can build those, if you can get those teams where people are like, look, you're all working, you're all on the same team. Let's act like it. But they have to know they're on the same team. So the network mapping makes you like, it's like jerseys almost. And so that allows you to mine these large networks and just really see not only who are the key decision makers, but if I want to make something happen, and let's say I want to talk to you, Marcia, but I don't know how to talk to you, I can use this analysis to say, says, who might work with Marcia? And Alice, you and Allison are on that South by Southwest thing. It might be like, oh, Allison and Marcia are on this thing. So do you know Allison? Oh, I do know Allison. And that's how it builds value, by just being like, who do you know? And how far away are you? How far removed are you from this person? And also, if you want to get in touch with them, who do they know closely? Because it'll show you.
Very interesting. So Mark, what's next?
So one is I want to keep developing this understanding the network analysis of what helps a female entrepreneur raise successfully and what helps someone raise successfully in general. And the other is to expand the endometriosis research and to eventually talk about how things like women's health conditions curtail their ability to raise successfully. Because ultimately, I want to look at the intersection between capital raise, and race, gender, and healthcare, and just see how they're all in a triangle. And so this is like working on two of the prongs, and then a little more, I'm always working on a little racism work. And so hopefully coalescing the three of them into getting like a good trifecta of, okay, we have a pretty good understanding of what your success is going to look based on this. And to make it better, here are concrete steps that we can take.
That's awesome. Mark, thanks so much for coming on the show today and telling us all about how we can get more funding to women's health. Hey, thanks for listening. To connect with me, visit my website at marciadawood.com. And if you're looking to learn more about investing in the changes that you want to see in the world, sign up for Ann and Bill Payne's ACA Angel University classes. You go to angelcapitalassociation.org, all one word, to find out the schedule. Many classes are offered, everything from the angel investing basics, fundamentals, risks, due diligence, term sheets, valuations, returns and portfolio strategy. And for a deeper dive, there are advanced classes which include capitalization tables, startup boards, and exit strategies. If you're not already a member of the Angel Capital Association, you can become one for the low price of $295 for the year, and that will give you unparalleled access to discounts, free webinars with a huge archive of content, networking opportunities, and much more. We'd love to have you join us. All content for this website is informational and not intended to serve as legal, tax, accounting, or investing advice. While Marcia, that's me, does serve on the SEC Small Business Capital Formation Advisory Committee, my views are my own and not the views of the SEC or my fellow colleagues on the committee. Our speakers and hosts are thoughtfully selected for their educational value, but their opinions are their own and do not necessarily represent the views of the host, me, or the Angel Capital Association, and neither specifically endorse the use of presenters' products or services. Listeners of the podcast should consult their own tax, investing, legal, or accounting advisors before making important financial decisions. All warranties, including accuracy, completeness, and suitability for specific purpose, are disclaimed.